More than 666,000 people have died from COVID-19 in the United States, and there are 152,000 new COVID cases a day. On average, 98,000 people are hospitalized in this country every day. Nearly 2,000 people are dying from COVID. Unvaccinated people are 11 times more likely to die of COVID than those who are vaccinated, yet only 54% of Americans are fully vaccinated. Parents are suing school districts over mask mandates. Republicans are suing the president over vaccine mandates. Meanwhile, everyday people are just trying to make sense of the massive COVID confusion and keep themselves and their families safe. What do you need to know to keep yourself safe from the surge of the COVID-19 virus? My guests weigh in, all coming up next.
Live from Los Angeles, this is the Special Report with Areva Martin.
There is so much COVID news. It's enough to make your head spin. From rising pediatric cases, booster shots, vaccine mandates, lawsuits over mandates, and drugs to deworm animals. The headlines confirm that COVID-19 is disrupting life as we all know it, and it's happening all across America. Well, today we're trying to make sense of all of these headlines. We're talking to real people and experts to get you the information you need to keep yourself and your family safe. Here for our lead-off discussion is Karen Alpert. She is a New York Times bestselling author, writer, and blogger. Her latest book is Mamas, Don't Let Your Babies Grow Up to Be A-Holes. I love this title. She's also the mother of two, one of which has been vaccinated. She's a returning guest to the Special Report. Good morning and welcome back, Karen.
Hi, how are you?
I'm good. Thanks for asking. I want to start by talking about this Kaiser Family Foundation. They did a study in August and found that half of all parents are holding off on vaccinating their kids, and many parents are actually opposing vaccines. I know that you wrote this blog post where you gently call out parents who say they don't want to vaccinate their kids. What motivated you to take pen to paper and talk to those parents who are having some reservations about vaccinations?
Well, I understand that vaccines are a very personal decision. I think that's legitimate. But these vaccines are what are going to allow our children to continue in school and have a safe place in school and keep other kids safe, which is why I think it's so important. I mean, I know our area is not just encouraging vaccines, but we're doing masks, we're doing shield testing. They're testing the kids once a week so that the virus doesn't spread throughout the classroom. All of these measures, every single one of them is so important to keep our kids in school. I mean, and we all know how important education is.
So Karen, you have two kids, right?
Mm-hmm. Yep.
You made the decision to vaccinate one of your children. It has to be at least 12 years old.
Yes, I would vaccinate the 10-year-old tomorrow if they'd let me.
One of the things we hear, Karen, parents say is, I don't know enough. I don't have enough research. So what research did you do that made you feel comfortable to vaccinate your 12-year-old and to come to the conclusion that you would also vaccinate the 10-year-old if, the shot was available for that age group?
Well, I think the absolute most important thing you can do is turn to the experts. So I turned to my pediatrician, and they recommend it. So that's most of the advice that I need. On top of that, I've stayed on top of just the science behind everything throughout this pandemic. I've just been keeping my ears open and my eyes open when I'm reading articles, and everything I see says that these vaccines are safe and important. And they keep our kids safe from a virus that's way more dangerous than any vaccine. So,
did you get any feedback on that blog post? Did you have any parents saying, what, lady, you're crazy. You're subjecting your kids to this dangerous shot, and that's some of the stuff we hear online. Did you get any of that?
Yeah, I always get feedback. Sometimes I read it. Sometimes I just stop reading it. I think I try to, catch more bees. You catch more bees with honey. So I try to be very nice when I comment back to somebody who's commenting, in a nice or unnice way. Of course, I'm going to get feedback. My blog, luckily, it's skewed more in the way I think. So I got a lot more positive feedback. I also, the posts that I ran about my daughter getting vaccinated, a lot of it came from her. Like, it was a video of her getting her vaccine and her making the decision to get her vaccine, of course, with our guidance. I mean, she's 12. She doesn't make all of her own decisions, and just so happened that she got it on her 12th birthday because that was the day it was released in our area. So she was I was worried because I scheduled it on her birthday and I thought she was going to get mad at me. She was like over the moon. She's like, this is the best present I can get. So
I am so happy to hear that this wasn't like mom forcing daughter, like you have to get this shot. This was your daughter on her own saying she wanted to get vaccinated. What happened? What was her journey like to get to that point where she wanted to get the shot herself?
Well, I mean, we've been playing it safe. We stay at home a lot. There have been no indoor play dates. There were no sleepovers. There still haven't been because our son's not vaccinated. In school, she has to wear a mask. We play it safe. And we told her, as soon as you get your vaccine, you don't have to be quite as careful anymore. And that was enough to encourage her to get it. And I know friends whose kids were a little more reluctant, and the parents basically told them, you're probably going to get this vaccine at some point, but we would encourage you to go look up your own research. At 12 years old, they're more adept at the internet than we are. So with a little guidance, because you don't want them getting all their research on TikTok.
Absolutely.
Right. But with a little guidance, you can point your kid in the right direction and show them why this vaccine is good for them.
Well, we know that, the Delta variant, and we've seen surges happening all over the country. Some areas, particularly in the South, are worse than others. I know you're in the Midwest. Have you had any family members or friends that have actually contracted COVID? Some maybe even that have had to be hospitalized or died.
Yeah, I mean, fortunately, no one that's been quite that sick, but I'm from Dallas. And we all know Dallas has had quite the surge lately. In fact, my father's coming to visit this weekend, and we had him get a COVID test before he comes. He just got his results. And I have a very good friend in Dallas who just got it. She was double vaccinated, and she went to a party, and an outdoor party, and still got it. So it's obviously very contagious, and we need to be very, very careful. Our entire family got it, and both adults were already vaccinated. So that's not a reason not to get your vaccine, because guess what? They got it and they weren't that sick. So probably a lot of the reason they're not that sick is because they were vaccinated.
Yeah, the breakthrough infections, we hear a lot about them, and people get really, freaked out about it and says, well, why get the vaccine if I can get the infection? And I tell people, that's like saying, why wear a seatbelt if I can still get into a car accident? We wear a seatbelt so that if we get into a car accident, we don't suffer severe injuries. And that's what the experts tell us about the vaccine is that, we can't guarantee you it's 100%. But what we do know is that the people who are vaccinated and who have a breakthrough infection don't get that sick. They have flu-like symptoms. They have, brief periods where they're down, but they recover. They're not in the hospital. They're not on breath, intubators. They're not on ventilators, and they're not, dying, which is the message that I think we want people to get. I want to bring into the conversation now Priscilla Blooming. I'm sorry, Priscilla. Priscilla is the mother of a 9-year-old, so her child is not eligible for the shot, and she lives though in Tennessee, in one of these red states that we've seen a really, tremendous surge. Good morning, Priscilla, and welcome back.
Hey.
I know you have a 9-year-old, and you heard Karen say that in a heartbeat she would give the shot to her 10-year-old. What are you thinking about your 9-year-old?
Yes, she actually just turned 10 last week, and she has already asked me when she's eligible for the vaccine. Again, like Karen was talking about, 12-year-olds are more connected than we realize to what's going on in the world. And she is tired of things being the way they are. She wants things to go back to normal. She's at a school where masks are mandated, but even though masks are mandated, they do the contact tracing. She's already had to be home due to contact tracing. And with that being said, she's tired of it because she knows that if she's able to get the vaccine, with contact tracing, she's able to continue to go to school unless she has symptoms or displays any type of COVID-like illness. And so that's why she said she's ready, even though she hates shots because she's a child, right? Hates shots. When it comes to the flu vaccine, we've always had to do the intranasal just because she cries, and it's a whole dramatic day that's just lost. But she's now ready for the vaccine whenever she is eligible.
I am so proud of these little kids who are acting so responsibly and just stepping up, doing research, and are following the science. And I'm really glad to hear too, Priscilla, that your daughter's in a school where there is a mandate, because we know that Tennessee has a mask mandate ban for, applied to all public schools in the state. And I also read something I want to share with you from a pastor from Lenoir City, Tennessee. I guess this is a town near Knoxville. His name is Pastor Ken Peters. And he's quoted as saying, "I don't want to be so afraid of dying that we stop living." And he says he's a big fan of freedom and that the government shouldn't mandate things. Karen, we're starting to hear folks talk about these mandates in this religious, frame, and suggesting that those of us that believe in vaccines and vaccine mandates need to stop worrying about dying and just accept that our life here on earth is going to be shortened by something. And if it's coronavirus, then so be it. What do you make of these arguments?
Well, I'm not going to touch religion with a 10-foot pole, but I believe that as humans, we have science, and we've used our brains to create things to help us live longer and be safer. And if a simple shot that takes you all of 10 seconds to get allows you to go about living your life in a safe way and helping keep other people safe too, which is huge, then why would you do it? Except for, I do feel bad about all the misinformation on the internet. Is killing me. My heart goes out to people that are hearing, misinformation after misinformation after misinformation. I feel sorry for them. I feel sad for them. I'm not angry at them. I feel bad because they're just being told the wrong thing.
Yeah. And Priscilla, you are in a state where, you hear a lot of people echo what that pastor said. Have you had friends say to you that, under no circumstances will they get vaccinated, and definitely not allow their kids to get vaccinated?
I've had friends who, before the Delta variant became an issue, young, healthy, they kind of looked at the whole situation like the flu. They knew that there was possibility that they could easily get sick, but once their parents were vaccinated, they felt that, as long as they just were safe, and didn't go around anyone sick, even though the whole asymptomatic thing confuses people, they didn't get vaccinated. But then once Delta has hit, especially here in Tennessee, I've had several friends then go ahead and get vaccinated. They weren't anti-vaxxers, but just the fact that they went ahead and knew people their age that were sick and dying. So they went ahead and went forward with the vaccine.
And just last question to you, Karen. That Kaiser Family Foundation study also showed that only 6 in 10 parents believe in vaccine mandates, which again, I find really interesting, because if you have stepped foot in a public school anywhere in this country, you've had to have your kids vaccinated. Vaccines have been mandatory in this country for as long as we all can probably remember. But yet only 6 in 10 parents believe in the COVID-19 vaccine for their kids. What would you say to any of those parents, the 6 out of 10 parents who, for some reason, were okay with getting their kids vaccinated, to start kindergarten, mumps, measles, those vaccinations, but are not okay with the COVID-19 vaccine? What words of wisdom do you have for them?
First and foremost, talk to your pediatrician. Ask your pediatrician what they think, because that is your guidance. And then you have to be the guidance for your kids after that. Pediatricians tell us to give our kids vaccines, to wear seatbelts, to our schools make us get them checked up get their doctor's checkups. They make us sign releases that say our kids can play sports because of concussions. We have to trust in our doctors and our scientists, because I'm not a doctor. I'm not a scientist. the best person I can ask is someone who has done the research and knows, and that is your pediatrician.
Yeah. Great advice. Thank you so much, Karen. Thank you, Priscilla, both for joining. Thank you for that, really compassionate and blog post. And I agree with you that even though it's frustrating, we have to temper our tempers and, meet people where they are and try to persuade people with the facts, with the science. Good luck to both of you. And again, congratulations for raising such incredibly smart and responsible children. I'm in awe of you guys' kids and the responsibilities that they've stepped up and that some of us adults are having some difficulties with. So not unusual for kids to lead adults, and hopefully some of those stubborn adults will follow. But again, thanks to both of you for joining me this morning. All right, we've been talking about what's happening with kids in elementary school. Now we're going to talk about colleges. What's happening on college campuses around this country? My next guest is Professor Matthew Boedy. He is a professor at the University of North Georgia, and he's also the president of the Georgia Conference at the American Association of University Professors. Good morning and welcome, Professor Boedy.
Thanks for having me.
Yeah, we found you, Professor, because of this emotional appeal that you made to the students at the university where you teach. And it was an appeal for masking to your students, asking them, telling them that you're going to be masked up and that you were vaccinated. And then they showed up to class. What happened when your students showed up for that first day of class?
Well, I am a rhetoric professor. My rhetoric was not very effective. My students, generally about 30 or 40% started off in mass. I did count yesterday in one class. I had about 50%. But that's just not good enough. We need, if we're all going to be a part of this, we all need to wear masks. And I've had several students write me and say that they would want to take up the opportunity to take the class online now that they've been in a class with very few masks. And it's just not a very good look to see out and see faces, sadly.
So you're in Georgia, and we know that you're in a state where mask mandates have been banned. There's been litigation, lots of litigation going on over masks. And so what's your university? Is your university allowed to do anything different than what the state has already ordered around masks?
No, our university is part of the university system, and the university system has said they're following the governor's expectations around mask mandates, which would be no mask mandate. We had one last school year, and they lifted it in early June before Delta came around and have not retreated in face of facts on the ground. They're not going back. They're going back to normal. That's where we are now.
And as a professor in this system that is following the governor's, lead on this, do you have any autonomy, any authority to say if you walk in this classroom where I teach, you have to put on a mask?
Sadly, I do not. Some other professors have tried that and really have tried different ways in which to suggest, no mask, no class, but that policy itself is not in effect. I've had an education professor teaching, the student teachers, and he really laid it on the line. Like, if you can't do this in this classroom, how do you expect it to do it in front of your own students in a year or so, or if it's still going on? And so there are a lot of ways we can persuade students, but we cannot force them out of a class if they're not wearing a mask. We can strongly encourage them, and I've done that every single day in my class, giving them some data point, giving them some stories, something to convince them to wear a mask and get vaccinated.
So what are these students saying to you? You're standing there fully masked. You've written about this. It's been featured in the New York Times. So, you've gotten national attention around your appeal. What's the feedback you're getting from these students who are being pretty defiant?
I get a lot of radio silence. It's tough to have a class discussion with masks on or with some people wearing a mask. And it's often a tricky subject if you don't know what to say and you don't want to offend the person next to you who may be doing the different from you. So I don't get a lot of direct comments other than through email, which is where, the individual things can happen. And like I said, I've gotten several emails from students who've come to class now and seen the percentage of masks and have taken up the chance that I've given them to take the class online. That is just a sign for me that sadly, there is a big disconnect, a big mistrust between students and between faculty and students. And that's just sad. And it's due to the lack of mask mandate. We all were in this together last year with a mandate, and now we're just not.
And you are a president of an association of professors that, work across the state of Georgia. What are you hearing from other professors? Because we're seeing these stories where some professors are saying, look, I just quit. I just will not, stand before a classroom of students who refuse to wear masks. We've seen that, several stories of professors just quitting their jobs.
Indeed, we've had several quit before the semester, one in the first week, and then they tried it out and they just couldn't do it. This week, we led a week-long statewide protest of faculty around the state gathering in their schools to protest these shameless policies. And so a lot of faculty are just frustrated, angry, and just really have nowhere else to go because both their work on campus is affected, but also they have children in K through 12 systems where there's no mask mandate. So it is a community that is just in dire need of more public health policies. My local hospital is overrun, and we're in a county with my school. And so the schools need to do, the colleges need to do their part. The university system needs to do their part because the faculty just, we want so much more to be protected.
And what's the difference? I think I read that about 1,000 or so colleges across this country, and I have some kids who are in a college, and they were really strict about showing proof of vaccination, getting tested before they could enter the campus, wearing a mask on campus, both indoors and outdoors. So there are colleges that have pretty strict policies, but how is it that those schools are implementing those policies, but yet we have schools like yours and other universities that are, pretty much define the CDC guidelines as well as the American College Health Association guidelines?
Well, I think if you look at those 1,000 schools, a lot of them are private schools and doing what they can. Some of them, public schools, are in different parts of the country. Some southern schools have done if you're not vaccinated, you're required to get tested, but few have mandates. And that is really due to the Republican governors around the Southeast mainly who have banned so-called vaccine passports. We have such a ban here in Georgia. We cannot mandate a vaccine due to that ban. And so it is a state level, it is a national level fight to get a mandate. And I think that's what President Biden was getting at after he announced the federal mandate. We've tried, we've urged, we've asked, we've tried to persuade, and 46% of citizens here in Georgia are fully vaccinated, and that's just not enough.
So last question for you, Professor, what are your options? You've pleaded, you've asked nicely, you've gone to the New York Times, you led this big protest. What other options are there for you and other professors like you that are, really facing this horrible situation? Keep your job, but keep it in a way that exposes you to people who may be infected with the virus.
Well, many of my professors and myself have become very creative in the way in which we organized our syllabi. Weeks of writing, individual conferences over video instead of in person, catch-up days that would not be in person. We really have taken away in which tried to figure out how we can be on campus less, which is a sad thing for college professors to do. But here, as Delta is burning through our campuses, that's one of the ways we have tried to protect ourselves.
Wow, I really am. That saddens me because not only does it, I'm sure, impact the quality of teaching for you, something that you must love because you do it as a profession, but also the students who are losing out, those students who are complying, who are vaccinated, who are wearing masks, now lose that opportunity to have that interaction with their professors. Good luck to you. Thank you for raising your voice on this issue. Thank you for your leadership on this issue. Hopefully with the president speaking out, we'll see more people getting vaccinated and rethinking. And as these hospitals fill up and we see more and more people unfortunately die, sad to say, maybe that's what it's going to take to move some of these governors. But again, thank you so much, Professor, for joining me this morning. All right, we've been talking about what's happening in schools, but not just schools and colleges, also bars and restaurants and gymnasiums are all facing, making decisions about who they allow in and if that person has to prove that they are vaccinated. My next guests are Lynnette Marrero. She is an award-winning New York-based mixologist, and she's the co-founder of Speed Rack, which is an association of mixologists. And also joining us is Synovia Moss. She is the project manager of the Good Health Women's Immunization Networks for the National Council of Negro Women. Good morning, Lynnette and Synovia. We've been talking this morning about all of this confusing information that's flooding our news feed about COVID. But one of the biggest things that has been in the news lately are these mandates. So I want to talk to both of you because you are working in some unique situations. I want to get your feedback Starting with you, Lynnette, you work in bars, you work in restaurants, and you're in New York City that back in August mandated that to enter restaurants and bars in New York City, you had to show proof of vaccination. And now LA, one of the second largest cities in the country, has said you have to do the same thing. And we know the president has said if you have over 100 employees, you've got to have a vaccine mandate. What do you think about these mandates, Lynnette?
Well, I'll tell you, they're taking it really seriously. As of September 13th, which would be the point where people would have their second dose, we have actually seen inspectors coming in, making sure that you have all the information posted, that it's up. I've even seen it be last minute communicated to certain events, things like galleries and gallery walk events that didn't previously know. So, and an event space right now that we're in as well, noting that that's happening. I think restaurants, we've been on the front lines of this for a long time, and we have been helping, guests get back to some sense of normalcy. And, we just have to keep, evolving with all of the rules and regulations. And it's difficult sometimes. Some people will want to argue about it, but where our hands are tied, it's like any other health department issue at the moment. We have to follow the guidelines and do it. And we're just all trying to keep with the pace and make sure that we're communicating well and efficiently. We have our first Speed Rack event in a long time on Monday. And we've communicated since day one that the key to NYC mandate would be in effect. And that anyone, who would be able to attend for safety would have to follow those rules and guidelines, be vaccinated, and then also just encouraging anyone who feels uncomfortable still in that environment to also wear a mask. So that's part of it, as well as making sure that our staff and our teams are all also putting in what precautions make them feel comfortable by wearing masks if they're serving guests, et cetera.
Yeah, I was in New York about a couple of weeks ago, and I was really shocked, Lynnette, that there was no mask mandate in place. And I asked several people what happened to your mask mandate, and they says the mayor wanted to incentivize people to get vaccinated. So he thought if he gave you the opportunity to not wear a mask, if you got vaccinated, more people would get vaccinated. Do you think that was the right policy? Because I felt a little weird, like, I wanted people to have on a mask because I was wearing one, and they weren't required to do so.
Well, I think that inconsistency is what also creates a lot of the confusion. A lot of the restaurants and bars that I've spoken to and work with have chosen to protect our community, just in case there's breakthrough and have less, issues from before. If one person, contracts COVID and with a breakthrough case, then how you go about approach that. So, the masks and that sort of walking around the restaurant when you're not at your table is just that extra precaution. So it is a bit confusing. And I think that becomes that problem, because then one establishment has tougher rules and another one doesn't, then you're combating this feeling of we want to be hospitable. We don't want to have that engagement. We want, from the moment you walk in, for you to feel that you're comfortable and that we have this mutual social contract with each other. And that's really complicated if the regulations are not consistent.
Yeah, and Synovia, 24 state attorney generals in red states have written a letter saying basically that the mandates that President Biden has, asked companies, private companies around this country to implement are a threat to individual liberty. And they're threatening to sue the president. What do you make of that? And you are representing or working on behalf of getting people immunized and in some of those red states.
Well, unfortunately, this has become very political, and coming out of the pandemic is going to require us to all do this together. And we know that we're better together. That's why we at the National Council of Negro Women are partnering with, so many of our national affiliated organizations to really speak to what can we do as individuals to make sure that we can do our part to get out of the pandemic. That we support the mandates that are going to help us, especially as we're watching what's happening in school district and employers. We want to guide ourselves out of this pandemic, and we can do this one shot at a time.
Yeah, Lynnette, there's some reporting that there was a hospital upstate New York where the healthcare workers, objected to the mandate to be vaccinated. They quit. The hospital couldn't deliver babies. I guess there was a lawsuit filed, and now there's this temporary injunction that prevents healthcare workers, this, from being required to be vaccinated. And you're hearing some employers saying, look, my employees are going to quit. I can't keep my doors open because people are refusing to get vaccinated. Are you seeing that in the restaurant and the bar industry where, people are quitting because they refuse to get vaccinated?
We actually, are seeing a very high rate of vaccination amongst hospitality. So that isn't as big of an issue. I do think it is complicated to not have testing in place for maybe a couple of those individuals who cannot be vaccinated. So that made it a little bit more complicated, I think, during this time. But, the hospitality community, I think, because we saw it and we were really, deep in, and there's no way back from hospitality if people can't gather. And there's a lot of people who rely on this work. And it is a type of work that often doesn't require a lot of pre-training. So it's very accessible for people to get into the job market. And so protecting that for people who really need and want to work in this industry is really important. Kathy Hochul, our current governor, she is just pleading with logic, that unvaccinated people are 10 times more likely to be hospitalized, 11 times more likely to die. And that's a statistic that we're seeing, and we're at 62.1% in the state, hoping that will, improve in the next few months, especially as we go into fall and winter, because once we have no more outdoor dining, we're in a really more compromised situation.
Yeah, I was thinking about that as I head back to New York in October and November. I'm hoping that maybe the new governor convinces the new mayor to get folks masked again in New York City. Synovia, I know a big part of your work is focused on the African-American community, and we've gotten unfair blame for being the group that is most hesitant about vaccines. So let's make sure we're clear that we are not the group that is preventing this country from reaching herd immunity. That's not Black folks. But there is still some hesitancy in our community. We do have to acknowledge that. So what are you doing and the organization you're working with to try to overcome that hesitancy that's still somewhat, persistent in our community?
So one of the things we know for sure that we're witnessing the rising numbers of the unvaccinated. And so it is very important for us to really get accurate information. And thank you, Areva, for using your platform responsibly in making sure that you're putting the experts out there. But our main message is very just definitive. If you're not vaccinated against COVID-19, please make a plan to get the vaccine. We're watching the rise in cases and death, primarily amongst the unvaccinated, which shows just how effective the vaccines really are. We are on the ground with our groups and organizations. We are hosting mobile clinics. We are responding to vaccines in schools. We are doing veggies and vaccines. So across our states and across our organizations, we have a whole host of kinds of activities that are really working. So whether it be hosting town hall meetings and virtual settings so that we can get real doctors in front of our population, whether we are offering our Uber free rides so that individuals can use the vouchers to get to vaccine clinics and testing, whether we're hosting health fiestas and combining our work with Black and Brown communities. We're very committed to be boots on grounds, to knock on doors, to do the canvassing, whatever it takes that helps us to do this data-driven work to get to our communities so that we can help our individuals make informed decisions and to get the vaccine.
Great work, and so glad to hear that this is, happening across so many national organizations, and it's happening across the country. One of the things we're battling, Lynnette, is the misinformation. So much misinformation on the internet, some of it coming from people who have huge platforms. I'm sure you saw the story about Nicki Minaj, the Met Gala, tweeting that she didn't go to the gala because she wasn't vaccinated. She's still doing her research, and then ultimately tweeting that her cousin in Trinidad won't get the vaccine because his friend got it and became impotent, said his testicles became swollen. And as ridiculous as that story is, Nicki Minaj has 180 million social media followers. She has, so that's like, the country only has 330 million people. So, 180 million of them are following Nicki Minaj. So when she speaks and says something, it has power. And we actually saw people go to the CDC office in Atlanta and protest the vaccines in response to Nicki's, comments that were so dangerous. How do we, fight back and help people understand that when they spread stories like that, that it's harmful. It undermines all the efforts that people like Synovia are doing.
Yeah, I mean, I think it's about, responsibility of what we put out on social media and the outreach we have, and knowing that it's our responsibility to educate ourselves like we are in every topic that we comment on. Social media spreads like wildfire. I've had to talk to a lot of friends, a lot of family members and people as well, and help dispel some of the myths. Some people were very concerned that we were still working on an emergency status for the vaccines. So as we remove that classification, I think there's going to be some progress there. And I think it's just getting that messaging and, supporting organizations like Synovia's who are doing that grassroots work, because it is going to take person to person, human to human, friend to friend, family member to family member to really get that message across. And hopefully you can break through the celebrity status of other people because you're someone who cares about them and can be with them, or want to be with them based on how they react now.
Yeah. And Synovia, any response from your organization, when folks like Nicki Minaj, because, she's talking to a lot of Black people, a lot of Black people follow her, and, what celebrities say in some, circles is like what, God says. They believe them. They don't care that the person is not a scientist, that the person is not, a medical professional. It doesn't matter. They're a celebrity. They're worshipped. And, we have that mentality, unfortunately, in many circles in our community. So any plans for your organization to try to push back on that kind of misinformation that's coming from celebrities like Nicki?
Well, we encourage our members and our partners to continue to have these individual conversations one-on-one, because although there is tremendous influence of the celebrities, we know that it is your mother, your father, your sister, your brother, your aunt that's going to be able to really to give you that consistent, continual message that you're going to see that as more of us continue to get the vaccine, that the facts are the facts, that the vaccines are safe, that individuals are really thriving after we get the vaccines. And we really want to be able to give our sisters the space and the grace that even when they don't know, that we give them the opportunity to get those informed information and make those decisions in their own time. It's really important for us that as trusted messengers, we really want to make sure that people understand that we're not going to force you to get the vaccine, that we're in this together. We are better together. We have to do this together. This is going to be a long time response if we don't get these vaccines, if we don't respond in a way that helps our children, if we want to have a sense of normalcy. So when we think about, a Nicki Minaj tweet, that was a tweet on Monday, and we're watching her go through that process of getting correct information. And eventually our hope is that she too will make that decision to get the vaccine. But we're watching a process. And so we want to support our loved ones. And for many, it is real, it is raw. Difficult decision to do the vaccine. But so this is one time that we feel like, we've got to think about the whole and not just ourselves individually.
Yeah, and that's a great point. And we do know that the White House didn't invite Nicki to the White House, but did say they would make doctors available for her to talk to. So hopefully she will talk to Dr. Fauci or some of the folks, that work at the White House or are involved in vaccines, and she'll feel like she has more research, more information, and hopefully she'll, as you say, come around, get the vaccine, and then hopefully do a video and share that with her 180 million followers. Look how powerful that would be. But again, thank you so much, Synovia, for the work that you're doing. Thank you, Lynnette. Always good to see you, both of you. Keep lifting up that message. We just got to keep talking to folks. We
need more Arevas.
Oh, thank you so much. Appreciate you, ladies, both for joining me this morning. All right, these ladies said it right. We've got to follow the science. We got to talk to the experts. So we're going to do just that. My next guest is Dr. Denis Nash. He is an epidemiologist and a professor of epidemiology at the City University, New York School of Public Health. Good morning and welcome, Dr. Nash. Lots of questions for you. I want to start with that tweet about somebody, a cousin or a friend or, somebody that knew somebody becoming impotent and testicle swelling as a result of the vaccine. Have you seen anything like that? Any evidence that that's, true?
No, that's not one of the side effects that we've heard about or what we would expect after a vaccine like the COVID-19 vaccine. I would say, so that's one thing. And I think the other thing to remember is that when you have so many people getting vaccinated, I mean, over 200 million people have gotten at least one dose of a vaccine in the US, for example. Lots of things are going to happen after a vaccine, right? Lots of things are going to happen that are totally unrelated to the vaccine itself, but people may connect them in their own minds. And so that's where these kind of one-off anecdotes can be dangerous. And I think, I think that's what happened here. It may be that all of these things happened after that individual received the vaccine, but it doesn't necessarily mean that that was caused by the vaccine.
Yeah, no, thank you. A cause and effect. So somebody has a heart attack and they've been vaccinated. Doesn't mean the vaccination caused them to have a heart attack. They may have had pre-existing heart condition. We know that people are always looking to blame something. And right now, the COVID-19 vaccine seems to be the target. I want to talk about these kids. I started the show talking to two parents. These are parents, enlightened parents who's been vaccinated themselves, kids, 10 and 12-year-old kids who are stepping up saying they want to be vaccinated. But we see this huge surge among school children. I think I read somewhere it's a 240% increase in new pediatric COVID cases since July, and that now more than 5 million children have tested positive. What's going on with school kids?
Well, I mean, some of this is related to, a lot of it actually is related to vaccination, right? The vaccine does make it harder for COVID to spread among people who receive the vaccine. It doesn't eliminate spread. As we've seen, there's lots of breakthrough cases happening. And the virus will always move to find a place to go. And so it's going to move into people who are unvaccinated, as we're seeing, adults and children alike. And in places where vaccine coverage is higher among people who are eligible, like adults, the virus is going to look to other places. And that's, by definition, is among younger people who are not eligible to be vaccinated yet. So that's a big part of what's going on and why we're seeing such big increases in transmission in young kids.
So if you are a parent and you are in one of these states where masks have been banned, vaccine passports have been banned, and your kid has to go into a classroom not knowing if the teacher's been vaccinated or the other students over 12 years old have been vaccinated, and half the students are not wearing masks, what do you do as a parent to keep your child safe?
I really feel it's so unfortunate, like we heard earlier from the professor in Georgia, the lack of a vaccine mandate really does impose increased risks for everybody involved. Of course, parents of kids who are concerned about COVID can wear a mask, but they don't get the benefit of other people wearing masks. And there really are two things going on here with COVID and masks. There's the reduction in risk that happens from source control. That is, when someone who has COVID and may not even know it is wearing a mask, they're much less likely to spread to other people. And then the people who are wearing the masks who are uninfected are also protected a little bit more because they're wearing a mask. So you're basically removing, I would say, more than half of the protection of an individual by letting some individuals not wear masks if they so choose, because it just wearing one for yourself is not going to do it.
So if you are wearing a mask, but you're in a classroom with other people that are not masked, your chances of getting COVID are, what percentage is that for you?
Well, we think that wearing masks for source control reduces the risk of transmission by about 50%, and wearing a mask for personal protection reduces it by about 30%. So combined, those two things, provide a considerable amount of risk reduction. But when you remove one, you're basically increasing the risk of people who are wearing masks. So it's nothing's perfect, right? Neither of those two things even combined are perfect. But together, layered on top of each other, we can get to a safer place for our kids who are just can't be vaccinated yet.
And we spent a lot of time early on in the pandemic talking about the types of masks. Remember when some states were saying all you had to do is wear a bandana or any kind of cloth? Are we clear now that the mask that needs to be worn is something more than a scarf?
I know that there is not clear guidance on this, and I personally think that we should be thinking about not only wearing any mask, but think about the type of mask, and especially in the certain situations. Sometimes, if I'm outdoors here in New York City in a crowd, I might wear a cloth mask in a public setting. But if I'm going indoors where there may be people without masks because we don't have a mask mandate in public places, I'm wearing a KN95 or an N95 mask. And I do think it provides an added level of protection. And these kinds of masks need to be on the table for situations like schools and workplaces. At the very minimum, there should be messaging about, not all masks are equal. Some masks are better than others.
Let's talk about New York for a minute, because as I just said earlier, I was in New York and I was just stunned that there was no mask mandate. And when I asked around, the answer I got was that, well, the mayor thought that if people got a reward, and the reward being not having to wear a mask, then more people would get vaccinated. That, and I live in Los Angeles, where July or so, a month ago, we reinstituted our mask mandate as we continued to push for vaccines. So we didn't see it as an either or. Is that either or policy that's being implemented in New York a flawed strategy?
I believe so. I agree with you. I think that our mayor was kind of short-sighted and seemed to only be able to think about vaccination as the main strategy to get us through what is a pretty significant Delta surge. In reality, the way this works is that you need multiple layered strategies, and masks and testing and social distancing and policies are a big part of what can help. Even if we have a pretty high vaccination rate among adults in New York City, it's still, there are still lots of people who are unvaccinated. And the reality is, even if all of those folks decided to get vaccinated tomorrow, it would be probably 6 weeks or so before they could be protected. And so what do we do in the meantime? And how do we protect those people? And how do we protect the people who are not able to be vaccinated at all? Public health really is about protecting the health of all people in society, and the mayor's job is to protect the health of all people, and to really be playing around and trying to second guess what people's behavior and response might be, to try to influence it based on very little evidence that it might work is folly in my view. And I do think they need to have a little more science and a little more public health subject matter expertise informing their policies.
So as an epidemiologist whose job it is to know this, who's a public health specialist, you would say if you are in New York City, even though you may be vaccinated, you should be wearing a mask.
I think in public places, especially indoors, it should be mandated. I'm thinking about workplaces. Of course, we do mandate it in schools. We have this, the message that I think a lot of people have gotten is that if you're vaccinated, you don't need to worry so much, right? That came directly from the CDC, and it was really propagated and amplified, locally. But this was all sort of pre-Delta. It's unfortunate that our public health leaders nationally and political leaders here in New York didn't foresee what was, I think, an inevitable outcome, this Delta surge. Many of us saw it coming because it was going on in the UK. What we've seen is that vaccination does not really protect as much against spread and transmission. The vaccines work very well for hospitalizations and death, but the efficacy of them to protect against infection and onward transmission has been going down with Delta. And so we really have to not make such a distinction between vaccinated and unvaccinated people with regard to masks, because both are capable of acquiring and transmitting the virus to one another.
Yeah, I'm glad you mentioned our national health leaders and the confusion that's been created, and that's why we're talking today. right now, as we speak, the FDA Advisory Committee is meeting to determine if COVID-19 vaccine boosters are widely needed. And we know that some of the big pharma companies, Pfizer in particular, has been out there for weeks saying that it has the booster shot available, it's ready to go, and that people should get the booster shot because after 6 months or 8 months of having gotten your second shot, that your protection starts to wane. And, some folks say these extra shots are luxuries. So the question is, are they a luxury or are they an essential part of keeping people safe?
Well, I mean, the first thing I'll say is that I'm glad that there's a dialogue and that we're thinking about this now and evaluating it now. It's important. Boosters could be an important strategy for some people, especially elderly people and people who are immunocompromised. We need to remember that the main goal of the vaccine rollout is to prevent deaths and hospitalizations and not overwhelm the healthcare system. And the evidence around boosters as it relates to that is not clear. There are some studies, but they have flaws that really prevent us from knowing confidently whether or not waning immunity presents an increased risk for severe disease and death should people get reinfected. On the other hand, there are some very compelling studies that have shown that the vaccine remains highly effective against severe disease and death, even in the Delta surge that has happened. Recent data from New York State and from the CDC, from 7 states around the US, the vaccine has not declined in its effectiveness in preventing severe disease and death. And so that, to me, says the bottom line of our vaccine program is still intact here. And it's a little bit premature to be thinking about boosters for the general population because of that. I think we need to see some more evidence, and I sincerely hope that the FDA advisory panel today, looks critically at this.
One thing is clear, and I use the word confusion, and I want to make sure that when I use that word, one, there is confusion, but to be fair to the scientists and to the public health officials like yourself, this is all very new. So this is a new, infection. It's a new strand, and scientists like yourself are learning this in real time. We have to be patient, and we have to be willing to accept that things change sometimes very quickly. And getting the messaging right, can be complicated in these situations where things are moving so quickly. So I do want to say that because I don't want to slam you guys who are working around the clock trying to get this right for us. So I respect your field and what you're doing. But if there is any chance that the efficacy could be waning after 6 to 8 months, why not err on the side of just being, safe and saying, maybe the data isn't 100% there that everybody needs a booster, but because Pfizer and Moderna have the shots available, let's just get them in arms of people. And that way we can just, give ourselves a little extra insurance, a little extra protection.
Okay, yeah, to that I would say, returning back to remembering what our overarching goal here is to prevent and minimize severe disease and death, right? That's the goal. So then you have to ask the question, given that we have limited resources for public health in this country and around the world, what's the better use of those limited resources? It's not a perfect world. We can't do everything. We may, in fact, and I believe this, that we would be able to prevent more deaths by focusing on people who are unvaccinated or partially vaccinated, and people who are elderly and people who have immunocompromising conditions. I believe that since we can't really do both to the extent that we need to.
But there's not a shortage of vaccine product in the United States for those elderly people who are, eligible for their first and second shot, is there?
No, but remember, it's not just about having the doses of vaccine on hand. As we've been hearing from your other callers, there's a lot that goes into efforts to try to, educate people, to talk to them, to convince them that it's important, and take the time to do that. And that I think is the place where we need to be spending our time and effort right now. And I feel strongly that we should be focusing on people who are most vulnerable to severe disease and death right now when it comes to vaccines.
Well, we'll be off the air by the time we get the news about what the FDA concludes. But what's your best guess? What are they going to come down with in terms of booster shots for the general population versus just boosters for those who have, certain compromised immunity systems?
Well, I really want to believe that we've moved beyond a place where politicization of the pandemic and the science, overrides what is the right and best decision based on what the evidence guides. FDA has always done a very good job at this, and I know that there are lots of speakers planning to come to the FDA or speak to the FDA on this issue. It's very clear to most experts that
speakers are coming to talk to say that the third booster shot should not be made available generally.
I think what they're coming to say is that the studies that people have been putting forward as evidence for why boosters should be happening in a widespread manner are flawed, and they're not yet in the place where they need to be to make such a big decision like this. And hopefully people on the panel will see that and be convinced.
Okay. So your recommendation at this point, based on the science and everything that you've reviewed, the studies, is that boosters aren't necessary. Is that for everybody or just general pop? Do you think they're available, that they should be provided to those who have compromised immune systems?
Absolutely, I do. And I also think elderly people who we know their immune systems tend to, not function as well as they used to when they were young. And they're also the ones that are at high risk for severe disease and death should they have a breakthrough infection.
So who else constitutes, who else is in a group of having a immune compromise, compromised immune system if you're not elderly? If you take the elderly out of the population, is it someone who's maybe on chemotherapy or someone who has a lung condition? What does that group look like?
Yeah, also people living with HIV are another important group. They may have immunosuppression. People being treated for malignancies, people being treated with steroids, organ transplant recipients. There's lots of groups that I think remain pretty vulnerable, and it's not even clear that boosters will work for them, but or all of them. But they have to be first in line in considering, that if they may need more in the way of a vaccine booster compared to everyone else.
And I want to ask you about this misinformation. I asked my earlier guest about it in the context of Nicki Minaj, but we also saw Joe Rogan, who got COVID and touted this ivermectin drug as a cure for COVID. Help us understand what ivermectin is and why it's not, a cure for COVID.
Yeah, well, this gets back to the evidence issue. There's lots of excellent scientists and healthcare providers generating evidence about trying to find new evidence that tells us whether or not different treatments are good or not for treating COVID. And ivermectin is not one of those treatments. And it's an example of how misinformation has spread. It's not to say that it's not something that could be used for other conditions, but the point here is to be consulting with healthcare providers always on decisions about what treatments you would be taking for anything serious like this. Unfortunately, this is something that's available over the counter, it seems, and so people can take it into their own hands, and it can be, quite dangerous.
But this is used primarily for animals, right?
It's an anti-parasite. It treats parasitic infections with parasites, and it can be used in humans as well for that. COVID is not a parasite; it's a virus, and there's not really clear evidence that it even helps. So anytime when there's no clear evidence, you always have to worry about whether or not there's a risk associated with it, and there clearly is one in the case of ivermectin.
Last question for you, or last topic I want to cover with you, is these breakthrough infections. We're seeing more and more people, from senators to people in other people in elected office, and just everyday people reporting that they've gotten COVID, even though they've been vaccinated. Some recently vaccinated, some vaccinated months ago. And for a lot of people that are on the fence about the vaccine, they hear these stories about the breakthrough COVID infections and say, oh, what's the point in getting the vaccine if you can still get COVID even though you're vaccinated? Why are we seeing what appears to be, and I don't even know if it is scientifically, but what appears to be an uptick in breakthrough infections? And why is it still so important to get vaccinated even though breakthrough infections may occur?
Right. So what we know from the clinical trials for the vaccines and some experience with the vaccine rollout after, with millions and millions of people being vaccinated, is that they remain over 90% effective at preventing hospitalizations and death. But what we have seen is that the effectiveness for infections, so this would be breakthrough infections in the case of vaccinations, has been declining over time. And that's primarily because of the Delta variant. It's much more infectious. And so even vaccinated people can get infected with COVID. They could have been double vaccinated. They can still get it. And that's going to happen more frequently in those places where there are both vaccinated people and high rates of community transmission. So that anywhere you see hotspots happening all over the country, you're going to be seeing breakthrough infections. It's not really a surprise. But the reassuring thing is that these vaccines work against hospitalization and severe disease at very, very high levels of efficacy. If we could get this kind of efficacy for the flu vaccine, we would be so much better off, right? So we're really, really lucky right now that these vaccines are so effective. And if you do want to avoid, getting and ending up in the hospital or having a bad outcome like death due to COVID, vaccines are really your only way to do it. And you need to do it quickly because it takes a while. One dose isn't enough, and you need a few weeks after your second dose of an mRNA vaccine.
Great point, doctor. And one of the last things that I want to talk about is these temperature taking measures that we see. Like we go into restaurants and we go into even your medical office, people are taking your temperatures. Is there any value in doing that for us? Should we be doing it at home, for instance?
So, no one measure is perfect at screening out or preventing transmission of COVID, but easy little things like temperature checks can't hurt, right? And temperatures, people can have fevers for a variety of things, and that you don't want to introduce into a public setting. So I would say, I don't think that they're a bad thing. And I also think it's a good idea when you're doing it to ask about other things like symptoms and travel history and recent exposures. So I think screening is a big part of how we keep transmission to a minimum. Testing is also another way, very helpful, also not perfect, right? We have many policies that are like, well, you have to have a negative test in the last 72 hours, and that's going to help, right? But it's not perfect. You need to remember that things can happen in the interim. And so I like some of the discussion that's been happening around, same day rapid testing, so that you can know that someone had a negative rapid test on the same day. And that's another strategy that I'd really like to see more of.
Yeah, no, you're right. We spent a lot of time early on talking about those rapid tests. Then it seems like it just fell off the cliff and, nobody's talking about, we were supposed to get those in our homes to be able to do like a home pregnancy test where we could just wake up in the morning and, test ourselves and, based on the results, not go into the public, sphere and infect other people. So I agree with you. I hope we see more conversation and more effort and more resources put into those rapid tests. Just lastly, doctor, you've said it, but can you just say it again, how important it is that people get vaccinated?
Yeah, despite all of the things that people are hearing and what we're seeing in front of our eyes, vaccination is really the only strategy that's going to get us out of this pandemic in the US and globally over the long term. We will not have any respite from the virus as long as we have low levels of vaccine coverage. Even people who are vaccinated have the risk of spreading it to someone who's unvaccinated who can have a bad outcome. So we need to get to a place where all of our vulnerable people and most people actually have had a chance to have 2 doses of vaccine, because it's really the only way out. There's if we don't get there, it's going to be a vicious cycle of worrying about outbreaks and hospitalizations and deaths. We need to get to a place where we worry much less about hospitalizations and deaths than we have.
Thank you so much, Dr. Nash, for your really great insights, answering some tough questions, and clearing up a lot of the confusion that exists around vaccines and the boosters, and just making it plain that the only way that we get out of this as a country is that we all, put our boats in the same direction, that we all get vaccinated, and we do those things like testing and mask wearing, distancing and tracing to keep ourselves and our families safe. Again, thank you so much for your information. Thanks for joining me this morning.
Thanks, Areva.
I want to thank all of my guests. I keep thinking we're not going to have to do COVID shows, but we're going to have to do COVID shows because COVID is here. And until we all get on the same page and all get vaccinated and all wear our masks and all do those things that the experts and the science tell us to do, we're going to have to keep talking about COVID. And guess what? I'm committed to it. I'm here for the long haul. We will keep talking about COVID because we have a responsibility to help those who are sitting on the fence, who feel a little hesitant about the vaccination. I know you're frustrated. I'm frustrated. I've told you stories about some of my own family members who aren't vaccinated that I've had to make hard decisions about not seeing. But one of our guests earlier today said, you attract more bees with honey. So even in our frustration, let's find ways to be civil, to be kind, to be compassionate. But please, please, please keep talking to your friends and your neighbors and encouraging them to get vaccinated. And my words to live by are get vaccinated. I'm out, y'all. Be safe out there. Wear your mask. Get vaccinated. Remember, we are all in this together.